I guess I didn't have the mic on. Good afternoon again. Health and Human Service will come to order. Thank you all for coming this afternoon. Okay, Madam Clerk.
Commissioner Baker McCormick,
Here.
Commissioner Marecki, Commissioner Anderson,
Here.
Commissioner Killeen, Chair Scott,
Yes, present.
you have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none today.
C, approval of the November 25th, 2025 meeting minutes.
Moved by Commissioner Killeen, supported by Commissioner Anderson. All in favor?
Aye.
All right, and I approve. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item.
Moving to item 1 under new business. Communication from the Michigan Department of Health and Human Services forwarding its rates for the cost of services for state wards for calendar year 2026.
Okay. Right. Good afternoon.
Good afternoon, Nathaniel McQueen, Chief Program Officer of Juvenile Youth Services Department.
Thank you.
Good afternoon, Rachel Davis, Director of Juvenile and Youth Services Department.
Thank you both.
Yes, so here today, what we're here is the question that's placed before the Juvenile Youth Services is the amount of monies that the state is charging for per bed. They make that rate, they set that rate forth, and then they distribute that to every county within the state of Michigan. We don't have a direct input whatsoever as to what that rate will be, nor do they ask any input from us in regards to that particular rate. So that's probably the simplest way I could put it for you.
Okay. Anyone? Yeah, Commissioner Killeen.
Yeah, thank you. So you showed us the rate chart for the upcoming year,
Correct, 2026, that goes into
Doesn't
effect
show
January.
past history,
Absolutely.
what's different,
So
if anything.
in 2025, the state rate was $320.70 for Shamu, with a chargeback for the county of $160.36. And for Bay Pines, it was $361.09, with a chargeback for the county of $180.54. In 2024, it was $367 for Shamu and 55 cents, with a chargeback for the county of $183.77. And then for Bay Pines, it was $409.44, with a chargeback for the county of $204.72. And then I could also provide this board with additional years if you would like.
Okay, couldn't do all the math in my head. Are we paying a larger percentage?
There has been a slight increase each year for the last 5 years. The state does indicate that they try to keep that minimalized for all of the counties within the state of Michigan, but there is a slight increase that happens each year.
To keep from having revolution, we'll just ding you a little bit each year. How many Wayne County citizens are affected by these rates?
So these rates, there is a state charge, so those will be state dollars. And then it is a 50-50 split between the state of Michigan and the county, every county.
How many people do we have in these facilities?
The total number of current people that we have in facilities right now, I'd have to get that number for you and give it back to you, get it back to this board right here. I don't have that exact number right at hand.
It's should be lower than it's been in previous years.
Yes, our numbers are significantly lower. One of the reasons that it is lower is because the state did close a number of facilities that they once had.
Yeah.
They were operational throughout the entire state. The state does have a responsibility to provide those beds for each county. However, the state did decide to close a number of those facilities. There are only currently 2 that we're able to utilize right now. And those are the 2 that I just mentioned, that being Bay Pines and also Shawano.
Yeah, if you could show that like over like a 5-year period just to see what that is. Have the promised number of beds ever materialize to be what they say it is? Or do they give us a number of beds that are available and then come to find out we can't use those beds because they're really not available?
The state is working on their capacity right now. And just a correction, Shawano is no longer in service. It's now MYTC. I believe that's Michigan Youth Training Camp or Council, something like that.
So
But
they just
it's,
moved it to another facility.
yes, that's correct. They're working on the capacity there right now. I believe it's a 60-bed facility as far as capacity. Their numbers are much lower than that right now because they're working on some staffing issues to fill the staffing requirements there.
The availability of beds is just across the spectrum is just horrible what the state does, in my opinion. So, all right, thanks, Madam Chair.
Okay. Anyone else? Okay,
Yep. Madam
yes,
Chair.
all right. Commissioner McCormick?
Thank you. I don't know, you said you don't have the number of youth that we have currently in,
We didn't bring that information to the commission, but we can provide you with that.
because at one point we had so many youth that I can't remember the number off the top of my head that were kind of waiting for treatment. And I was just wondering if where we are in that.
Yes, ma'am. There are a number of youth that are currently at the JDF,
Right.
the juvenile detention facility, who are awaiting state placement. And for lack of state capacity, that's why they're still in our facility post adjudicated.
Yeah, but what does that number look like? I think that's what I was asking, like the last
It fluctuates.
the last meeting we had, so.
Yes, ma'am. It fluctuates daily. I think today we could be in the 30 to 40 range.
Okay.
For
That's waiting.
Post adjudicated youth that are housed at the juvenile detention facility, waiting for a state bed.
Okay, because I know the numbers were really high and then we gradually reduced those numbers, so. Okay, thank you.
Anyone else? All right, and yes,
Could you add some of those numbers to what we talked about previous, about how many county people are in these facilities, looking back over 5 years?
Absolutely.
And I know with jail populations, it does vary day to day, but if you can, there's going to be some sort of average of who we're holding, because 30 to 40 people that have been adjudicated that are sitting in the wrong facility,
That is correct.
that's not good at all. So if you could give a sense of that when you give a report on how many we do have in those facilities, and then I guess this is the waiting list then. And if you could kind of give us an idea how that's been going over.
Oh, yes,
time.
absolutely.
Thank you. Thank you, Madam Chair.
all right, we need a motion for receive and file. Been moved by Commissioner Terry and supported by Commissioner Colleen. All in favor?
Please vote using your tablets.
Okay. You get me.
Motion carried.
All right. Thank you. All right, next item, please. Thank
Mo-
you.
Moving to the addenda, item 2, requesting commission approval of a 2-year intergovernmental agreement with Health Choice of Michigan to provide administrative and management support to fulfill its duties as a municipal health facilities corporation.
Good afternoon, Keneal Johnson, Director of Health, Human and Veteran Services, and on Zoom with me, I have Chris Johnson. He is the Director of the Access to Care Division. And today we are requesting approval of a retroactive intergovernmental agreement between Wayne County and Health Choice of Michigan. The intergovernmental agreement was effective October 1st, 2025, and will continue through September 30th, 2027. In consideration of the managerial and administrative support services, as well as the facility use, Health Choice of Michigan will reimburse Wayne County for an amount not to exceed $2,270,000 and $426 total for the 2-year term of the agreement. The IGA, this is retroactive because earlier this year, Corp Counsel did identify that there was a conflict in Wayne County Corp Counsel representing both Health Choice as well as Wayne County. And so as a result, Wayne County did have to seek out separate counsel to review the agreement. And so it did take some time to do that. And then we also wanted to process an amendment that was presented to you all probably about a month ago, amendment for the contract that ended this year. And so that amendment was processed, and then now we're moving forward with the new agreement that began October 1st of this year.
All right, any questions of Dr. Johnson?
I'll move approval, Madam Chair.
All right, moved by Commissioner Khalil, supported by Commissioner Anderson. All in favor? Please vote.
Motion carried.
Carried. Thank you. Thank you, Dr. Johnson. Next item, please.
Item 3, requesting commission approval of a 1-year agreement with the Michigan Department of Health and Human Services to receive and disperse state grant funds for the fiscal year 2026 local health department comprehensive grant to carry out program activities for numerous local health department program services.
All right, thank you.
Hi, good afternoon. Dr. Shath, Chief Medical Officer, HHVS. We are presenting for your approval our annual MDHHS Comprehensive Planning, Budgeting, and Contracting Agreement, otherwise known as CPBC. This is an annual grant we receive that supports the operations of various public health programs across HHVS. We were funded at 14.6 million approximately this year to support these programs.
All right, thank you. Any questions? Yeah, Commissioner Khalil.
Thank you. And good afternoon. These are not negotiated. They just send them to us, right?
Correct.
There's no discussion about what we need, or they make the decision in Lansing, this we're gonna send you to you.
Yes, and many of these programs are based on a funding formula that they apply across jurisdictions. And so, yes, it's a pretty standard amount.
Thank you.
Mhm.
Thank you. Anyone else? Commissioner Marecki?
Thank you, Madam Chair. So last year, we got over 21 million, it dropped to 14.
Mhm.
Do you know why?
So we wanted to do apples to apples. We want to do what the initial award was, because we do get 3 or 4 amendments, as you are aware, throughout the year. Then funding goes up and down depending on where things are at. So at the start of last year, we were about at 17.7 million for the initial award. So this is a decrease of about 3 million. The vast majority of that is from a COVID grant that sunsetted last year. And then there was also about a 1 million decrease in the WIC program as well. And I know we've discussed that in prior meetings.
So we may get some more added to this 14 throughout the year then.
Yes, and so we actually do have an amendment already that we're processing to present in front of you that will include an increase of a few programs that they just administratively left out of the initial agreement.
Okay, thank you.
All right, thank you. Anyone else? All right, I need a motion.
I'll move approval.
Moved by Commissioner Khalil, supported by Commissioner Anderson. Please vote. Yes. All right. Thank you. Motion carried.
1 second, Commissioner Baker McCormick. Motion carried.
All the rest of, okay. All right, these are the next item, please.
The next several items, items 4 through 14, are our youth assistance programs. Item 4, requesting commission approval of a 2-year intergovernmental agreement with 3 1-year options to renew with the city of Wayne. Item 4, requesting commission approval of a 2-year contract with 3 1-year options to renew with Diversified Community Services. Item 6, requesting commission approval of a 2-year contract with 3 1-year options to renew with Centers for Family Development. Item 7, requesting commission approval of a 2-year intergovernmental agreement with 3 1-year options to renew with the city of Westland. Item 8, Requesting commission approval of a 2-year contract with 3 one-year options to renew with Southwest Counseling Solutions. Item 9, requesting commission approval of a 2-year contract with 3 one-year options to renew with the Guidance Center. Item 10, requesting commission approval of a 2-year contract with 3 one-year options to renew with CCMO Center for Youth and Families. Item 11, requesting commission approval of a 2-year intergovernmental agreement with 3 one-year options to renew with the Downriver Community Conference. Item 12, requesting commission approval of a 2-year contract with 3 one-year options to renew with Vista Maria DVA Inside Youth and Family Connections. Item 13, requesting commission approval of a 2-year intergovernmental agreement with 3 one-year options to renew with the Conference of Western Wayne. Item 14, requesting commission approval of a 2-year intergovernmental agreement with 3 one-year options to renew with the City of Garden City. And these are to provide youth assistance program, judicial prevention services for at-risk youth ages 7 to 17 years old.
Do we have any questions on any of these?
Oh, yeah,
Okay,
but but maybe they want to speak.
okay,
first.
go ahead.
Good afternoon, Rachel Davis from the Juvenile Youth and Services Department as Department Director.
Good afternoon once again to this board. Nathaniel McQueen, Chief Program Officer, Wayne County Juvenile Youth Services.
So as stated, we're here to review the approval of 2-year intergovernmental agreements with 3-year one options to renew for several vendors that provide youth assistance programs, preventative services for youth in Wayne County.
Thank you. Commissioner Marecki?
Okay, thank you. All right, so the total now is up to shoot, I had this before. How many are there total now?
Well,
12, there were 13 and then
this
Ennis
dropped out.
dropped out. Okay, so going through each of these, everybody's pretty much getting the same amount of money.
Pretty much.
I mean, we pay like 25 cents on the dollar and the state pays 75 cents on the dollar.
Mhm.
Is right? So it's pretty much the same. I mean, someone went down to 400,000 and then someone just had the 1/10 mil and they're getting 100,000. But the numbers of kids that are going to be reached are all over the board.
Yes, if I could explain, we did a RFP, I believe, in April of this year. We had responses that totaled about $8.5 million in funding that they were requesting for the youth that they wanted to serve. However, the budget for the YAP program was only $3 million. So what we did was negotiate it with each of the successful awardees, and we reduced the amount of money that would be available. So therefore, they had to reduce the amount of youth that could be served. The same services will be provided. However, the number of youth that they would be able to reach is reduced from what they intended with the 8.5 million in proposals that we received down to the $3 million budget that we had to spread across these successful awardees.
That was a $3 million budget for Wayne County. That would have been Wayne County's money or
Yes.
total? That'd be a total.
My understanding is of Wayne County. Wayne County had a $3 million budget for the YAPs.
Okay, so then it's the intent that some of these kids won't get served because there won't be enough money.
That is correct.
So, and we've always like been proponents of these projects, so these kids don't end up in a jail situation or since this is a diversion. So are these, so did these groups, they were the ones who said how many kids they're gonna target? They gave that information to Wayne County?
Through their proposals of combined $8.5 million worth of services. However, like I said, we had to renegotiate the amount of funds for each organization because of the $3 million budget that we have to work within.
Okay, so just jumping ahead, I mean, there, again, the number of kids are all over the place. I mean, one was 400 to 400. But if some of these groups don't use their money, the 250,000 a year, will that money be available to other YAP programs that need the money to service kids?
Well, based on the RFP, I believe the only people that will be able to access the money are the people who were successful awardees of the RFP.
No, but what I was saying is, for an example, let's say the city of Wayne, I think they said they could do 250 kids. What if they only get to 150 kids? That money that's left over, can that go to another one of these YAP services that are possibly funding out of their own groups to get to these kids? I'm sure none of these programs want to turn away kids.
I'm sure. That is not an answer that I'm prepared to answer, a question that I'm prepared to answer, but I can get back with you to see what will happen if one particular organization does not use the total of their funds.
Okay.
Okay?
And I just, my own opinion, I don't know what's gonna happen if these groups can't reach kids because they don't have money. What's gonna happen in the future with those kids, since I mean, this program's expanded. Now we have more YAP groups here in this contract. So, and I know it covers all different area zip codes, but I'm just kind of perplexed by the whole proposal, I guess. But that would be great. That is my biggest question.
I will get you the answer to that question, Commissioner Murray.
Okay,
Thank
thank
you.
Yeah.
Yeah, thank you.
Okay. Commissioner McCormick.
Thank you, Madam Chair. Okay. Yeah, this is a lot. The process of the various groups that we the subgroups, I guess, the subcontractors. What is the process of vetting these individual groups? Because there's a lot of subcontractors that are working with the main organization or group.
I do know that there are requirements for any subcontractor, especially subcontractors that work directly with youth. They have to pass certain background checks. I can get you specific information so that I don't miss anything.
Yeah, I guess it's just so many. I'm wondering how, I guess it's not our job to manage the day-to-day, but just in understanding what controls each of these groups have in place to manage our young people. Some of the groups I'm familiar with, some of them I didn't know they did this type of work. So that's why I'm asking that question, because it's interesting. Vista Maria. Doing business as Insight, because I thought Insight was doing business as Vista Maria, and then now recently Vista Maria closed, or
So Vista Maria will conclude their residential programming,
okay.
but they'll still
they
offer
still
YAP
offer a
services.
YAP service. Okay, that's why I was kind of confused about that. Okay, I think that was the questions I had. All right, thank you.
You're welcome. Commissioner Anderson? No. Oh, okay. Commissioner McLean?
Thank you, Madam Chair.
Mhm.
Every year when this comes up, this committee has a lot of questions. So the county allocation of 3 million this year, or 3 million and some change, what was the allocation last year from the county?
So this is my first year. I can get you the answer to that question.
Nobody in here knows? I'd like to see over the last couple of years, again, just to see what the And then the state pays 75%, did you say?
That is correct.
So how does that work? We do RFPs and then we send up to the state, this is who we want to fund this year and this is our contribution. Where's your money? How does that work with the state?
We do receive a reimbursement from the state.
You do what?
We receive a reimbursement for the state based on the
Oh,
child care fund rules.
Okay. So it's reimbursable, no strings attached. They never say no.
As long as there are services that are in the CCF annual budget that is submitted so that the
No,
services.
don't acronym, please. In the what budget?
The child care fund.
Oh, the
budget.
child care fund. Okay. All right. And Madam Chair, because we do have these discussions all the time, I wonder if it would behoove this committee to invite some of these service providers down here and talk directly to them about what they're doing. I think it would be very helpful to this committee in understanding that. But I think extending an invite down and have a discussion here at the committee and a lot of the things that commissioners are asking about, I think would throw a lot of light on it and maybe even make this meeting shorter when it rolls around, maybe. But I'm just throwing that out as a suggestion, Madam Chair.
I think it's a good idea.
Thank you.
Yeah, there's
Just one more.
Mhm.
Yep, so through the chair, to Commissioner Clay, did you just ask for the last year or did you ask for the last few years as far as,
The county budget?
yeah,
No, I wanted to go back a few years to
Okay.
see a trend. Why don't we just say 5 on all of this, right?
Mhm.
How many kids, how much the budget?
but what was it, about 2 years ago that it ended up being a 75-25 split instead of a 50-50 split?
Yes, that is a recent change.
About 2 years, okay. So we'll have to take that into consideration. But you're saying the budget then is just $3 million, period, so. Okay,
Yes.
all right, thank you.
Okay, for those that just came in, we're taking all the apps together, so if you have some questions on it, now is the time. Terrence. Oh, Terrence, I'm sorry. I wasn't looking that way. Okay,
Through the chair, just for clarification, is that 3 million include the state's portion? Or is it 3 million plus a 75-cent reimbursement, 75%? Or is that 75% part of that 3 million?
It's 3 million total, and it's my understanding that 75% of the 3 million is reimbursable.
Okay.
does that answer you,
Then can I ask one
All right.
more thing?
Commissioner Maragall?
Thanks. So we can spend whatever we want on this program and the state's gonna give us the 75%.
My understanding is that we have a $3 million budget, and this is new to me coming new into this role as director.
Yeah.
But if there is some language that I might not be aware of, I can definitely seek clarification.
Okay. Yep. We'll have this before full board, right?
Okay.
Yeah, thank you.
Oh,
Just one more question.
Terrence,
How much do we receive from the 1/10 meal for the youth services?
Right. It's what? Okay. I have that answer for you. Give me 1 second in my notes.
you got a question?
Can I say something? And in the meantime, there's only 2 of these groups that are getting part of the 1/10 mil that I could see on the agenda.
That is correct, Commissioner. And
So-
the 1/10 meal does change yearly based on taxes for that community.
Right. So even if you take out the 1/10 mil, which is separate from what we're talking about, the child care fund and the match, then everybody's pretty much getting the same money except for the Downriver community, it looks like is only getting the 1/10 mil. They're not getting anything from the child care fund unless that was a mistake. But yeah,
All right. Attorney Felicia?
So for clarification, there are 4 entities in the one-tenth meal ordinance. Can you explain why only 2 are getting a contribution? Detroit, Downriver Community Conference, Western Wayne, and I think the Eastern something, right? So why are only 2 in here? Can you explain?
So if my understanding is correct, all of the providers or all of the cities get money from the ordinance, from the 1/10 meal, but some of them get it direct and some of them are provided for by one of the conferences. And that is just my layperson understanding.
Madam Chair. And I did some delving into this and it seemed like the 1/10 millet was tied into an agreement with some of the groups that didn't use the jail millage. And it was an agreement between McNamara and those outlines. So I think I don't know what it is. It's all over the place. But as far as this is concerned, there's only 2 communities that are getting the 1/10 mill, right?
That is my understanding, yes.
Attorney?
I will look at that after the meeting and maybe have a follow-up discussion with the department.
Okay,
Thank you.
thank you. Yes, Commissioner McCormick.
Thank you. Yeah, just a quick question about the reporting. How often will the YAPS report to you? I don't know if it was every 6 months or
Yes, yes,
what
so
was it?
quarterly,
Oh,
they have an audit that's done quarterly
Okay.
by our case managers. And then if there's any discrepancies or any problems, those then are addressed immediately at that particular time. And then they have a certain length of time to clean those discrepancies up. But there are quarterly on-site audits done.
And then a report is submitted annually.
annually. Okay. Thank you.
All right, thank you. Anyone else? Yeah, Commissioner Khalil?
Yeah, thank you. And I want to follow up on my request here because now, as usual, a lot of interest in this committee. And it's hard to get a handle on. I had forgotten all about the 1/10 mill and how that plays in, and some cities do and some cities don't. And some of the other information that we talked about that administration's going to get back to us on. So why don't, when we invite a few of these down to have a discussion, we also have a discussion in light of the new information we have. Once we know, over time a little bit what the county investment has been in this program, seeing the number of kids. So maybe we can make that a part of having a discussion item too. What are the consequences of the numbers that we're going to be getting? Because the commission has always supported this kind of activity, but not always in full view of all the numbers. So maybe once we get these numbers back from administration, that can be part of the discussion too.
Okay,
Thank you, Madam Chair.
thank you. Anyone else? Okay, now we'll need a motion. This is contingent upon getting all the information that we need for the meeting.
And this is for items 4 through 10 and 12 through 14.
And in addition to some corrections, right? Did we mention those? Motion should be.
Through the chair, Amina Spivey, Commission staff, the motion should be items 4 through 10 and 12 through 14 are contingent upon receiving corrections from the department prior to full board.
There are some amendments and corrections that are needed to the agreements to make them correct, but they're here today so that we can get them to the next full board. So I think the department is aware of those amendments, and that's in addition to some of the information that you've requested. And I don't know if you want that information that's requested at the table before full board as well? Or just, okay, so the information requested at the table and then the corrections from staff contingent upon.
Thank you.
Is that good? Okay,
We understand. Thank you.
all right.
Sure. Could
Commissioner
staff
Clement.
share what their reservations were that needed more information?
There were some concerns, I believe, with the subcontractor information. There were some concerns because the amounts were incorrect. So it would state one amount in one section and then the exhibit would have a different one. So they just need to correct some, I won't say typographical, but errors in that manner to make the amounts consistent throughout the agreement.
And full board's going to be next Thursday?
Yes.
Does the department think that they can get to us what was requested at the table here, aside from what staff looked at when they went through the contracts? Is that possible to have by next Thursday too?
So there's two separate requests. The first request is what was previously asked for as far as the appendices and the corrections to the numbers. We have made a request to all of the vendors to provide us with that information so that it can be provided to this body. Contingent upon receiving that from them, which we gave them today as a deadline, we do plan to provide that information. And yes, we can provide the answers to all of the questions submitted to us today on our next meeting.
Okay, because I think that'll provide a basis for a further discussion down the road in this committee of just the YAP in general. We'll have the information that we've looked for. So, but we can have it all for next Thursday.
That is correct.
Yeah, thank you.
All right, thank you.
It's good.
Okay, so I'll need that motion and support.
I'll move approval, Madam Chair, with all.
Contingent upon. Yes. Right.
But yeah,
Contingent upon all the additional information. Okay,
Thank you.
all right. Yes, you're welcome. And it's supported by who? I just see Tim. Out. McCormick, okay, and supported by McCormick. All in favor? Aye.
Madam Chair, through the chair to the clerk, I'd like to abstain on item 13.
Item 13, okay, abstain.
Duly noted. The motion passes.
Thank you. All right, next item, please.
Moving back to the agenda.
Mhm.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Okay,
G, public comments.
is there anyone online?
There's no one on Zoom indicating that they would like to speak.
There is one.
No, there are none.
There's not. Okay, thank you. Anyone in the audience would like to speak? Anyone in the audience would like to speak at this time? Hearing none, then we need the next item.
Adjournment.
It's been moved by Commissioner Khalil and supported by Commissioner Anderson. All in favor?
Aye.
Aye.